Well, good afternoon, everybody. My name is Terry Lake. I'm the Chief Executive Officer of the BC Care Providers Association and Engage BC. And before we start, I'd like to acknowledge that many of us are on the traditional territory of the Coast Salish First Nations. I am coming to you today from Kamloops on the traditional territory of the Secwepemc people. So we thank them for the opportunity to hold this dialogue today. I'd like to welcome everyone viewing here today to partake in what I think will be a very engaging and informative information session to discuss vaccinations, particularly for those working in seniors living and care sector. Should vaccinations be required? And if not, are there other ways vulnerable residents can be protected? As highlighted in the media, the issue of mandatory vaccinations is one of significant controversy with strong opinions on either side. And while the BC government has not indicated any intention to make vaccinations mandatory, others have argued that they should be. A recent article in the Canadian Medical Association Journal found, for example, that an effective vaccine provided to all healthcare workers in Canada will protect both the healthcare workforce and patients. That would reduce the overall burden of COVID-19 on health services. And it says that provincial governments should put in place rules for mandatory vaccination of healthcare workers rather than leaving it to employers. As many of you may be aware, Quebec announced earlier that they would put in legislation to make COVID-19 vaccinations mandatory for healthcare workers in certain sectors, including long-term care, or in place of that, recurrent preventive screening or redeployment elsewhere where feasible. In light of these issues, along with looking at the existing legal framework in BC and Canada, this webinar will discuss mandating vaccinations and including ethical considerations and arguments may be put forth by governments and employers. In particular, the discussion will include the pros and cons of making vaccines mandatory and if that should be something that should be advanced further, or are there other mechanisms that can be put in place. To discuss these and other issues today, we have a very distinguished panel, including Jina, Dr. Annalee Yassi, and Barb MacLean. And I'll now introduce each of them before they will each then provide opening remarks. First, I'd like to introduce Jina, President and CEO of Park Place Seniors Living. Founded by Al and Jenny Jina, Park Place Seniors Living is a family-owned and operated company based in Vancouver. Al is a lawyer by training and opened up their first location in Nelson, BC in 1993. His goal then, along with his wife, was to enrich the lives of seniors and define a new quality of care. Today, Park Place has grown to include more than 30 residences located in communities throughout BC, Alberta, and Ontario, including several independent retirement residences. Al also serves as a member of the BC Care Providers Association board and is on our priorities and policy committee. Following Al will be Dr. Annalee Yassi, a professor at the UBC School of Population and Public Health. Annalee holds a Tier 1 Canada Research Chair in Global Health and Capacity Building. As a medical specialist in both public health and preventative medicine, as well as occupational medicine, a large part of Dr. Yassi's research focuses on collaborative roles in occupational health and infection control in the healthcare workplace. Dr. Yassi is leading a CIHR-funded project in Southern Africa as well as Ecuador, looking at major interdisciplinary projects to reduce tuberculosis and other occupational lung diseases. And finally, I'd like to introduce Barb MacLean, the Executive Director of the Family Caregivers of British Columbia. Barb has over 30 years experience in nonprofit, government, and private sectors and has spent many years in the developmental disabilities field, specializing in supporting some of the most complex and challenging individuals living at home, in residential care, and in school settings. Barb has a Bachelor of Arts from UBC and a Master of Arts in Leadership and Training from Royal Roads. Barb knows firsthand what it's like to juggle work, a young family, and caregiving as she supported her family during her own mother's fight with cancer. And Barb is deeply committed to influencing change to achieve recognition and support for family caregivers. So welcome to all of our panelists. And with that, I'll turn it over for Al and his presentation. Over to you, Al.
Hello, it's good to see you all. If you could put my slide deck on, please, and I'll lead you through it. COVID has been very challenging for long-term care. Just at the beginning, the next slide, I have no business interests in vaccination companies. So I just wanted to get that out of the way. And next slide. This is a very timely subject. As we all know, COVID-19 has presented huge challenges to long-term care. It has been a roller coaster for us. It has brought a lot of issues forward for us. Vaccination has brought us some much needed relief, but currently staff immunization is not mandatory in long-term care in BC. It is only a strongly recommended practice. Next slide. I have had extensive discussions with my clinical leadership teams, the directors of care, and as well as nurses on at our sites, and the ethical and legal considerations that we have to consider when we are considering the issue of mandatory vaccination are as follows. In terms of ethics, is it ethically permissible for employers to mandate COVID-19 vaccinations for long-term care staff? And legally, there are 6 major pieces of legislation or case law that have to be considered. And they're as follows. Occupational health and safety legislation, which protects workers from job-related risks. Employers have an obligation to keep their staff safe. And what are we going to do about it? Human rights legislation, which protects against discrimination on a set of prohibited grounds, religious beliefs, security of the person. We have to consider that as well too. Other legal considerations. Next slide. Privacy legislation, which protects the privacy of individuals. What are the privacy rights around vaccination status of individuals? The Canadian Charter of Rights and Freedoms, which provides constitutional protection of citizens' rights from the actions of government. Now, we never really have had to worry about the Charter of Rights and Freedoms in long-term care. We do have a residential Bill of Rights, but that's very different. But the scope of the application of the Charter of Rights has increased recently, and so it is an issue that we do have to consider. Employment law, which governs employee-employee relationships, and labor arbitration cases, which deals with the interpretation and application of a collective agreement in a workplace. And we do tend to many collective agreements in long-term care. So next slide. For ethics, we need to focus on the harm principle primarily. And the harm principle is as follows. People should be free to act however they wish, unless their actions cause harm to somebody else. And this principle was first proposed by the English philosopher John Stuart Mill. We need to understand, it is important for us to make trade-offs between personal liberty or autonomy and the promotion of public health. And we need to think about that. And that issue has become very clear with the pandemic. In terms of law, long-term care again is at the intersection of 6 sets of law. So it can get very complicated. And we have to carefully navigate through the layers of applicable law. For long-term care operators, the standard would have to be one of reasonable accommodation. It is going to be very difficult to meet each and every set of law. And after completing our analysis, at Park Place, looking and reviewing the legal and the ethical issues, we have reached the decision that we are going to be implementing mandatory vaccination for new hires and for new job postings. All of our policies at the workplace are going to be updated to reflect this requirement. However, this requirement will be waived for legislated protected human rights grounds, where there are bona fide reasons that are presented. And those are my opening remarks. Next slide.
Thank you, Al. And now we'll turn it over to Dr. Yassi.
Yes. Well, thank you very much for allowing me to participate in this really important discussion. I usually have a PowerPoint, but I don't this time, so I hope that what I'm going to say doesn't come off as powerless and pointless. I want to begin by saying that I have been vaccinated with my first dose. I'm eagerly awaiting my second dose. I encourage vaccination to all my family and friends and colleagues. The work I'm doing at Vancouver Coastal Health is very much encouraging people to get vaccinated. But I believe that discussing mandatory vaccination of COVID-19 at this time is a bad idea. And I think that for several reasons. First of all, it's really the idea of we need our workforce and our population to trust institutions, to trust public health. The data is still being collected. You hear news all the time. Now AstraZeneca is not being used in Ontario and Alberta because of the risk being higher than originally thought. We have new mutants coming up, new variants coming up all the time. We don't know if we're going to need annual vaccines for COVID-19. There's too much still unknown to not give people the dignity of choice. And on top of that, we do know that the vaccines are not 100% effective, even against the wild variant, let alone new ones that are coming up. And we do know that there's side effects. So we risk exacerbating distrust in our population if we move too quickly towards a policy of mandatory vaccine when the data really does not yet support going that far. Beyond that, though, I believe that it diverts attention from what's really more important to protect our population, our patients, especially in long-term care, of what needs to be done. Because regardless of what variants are there, or even whether there's a new emerging disease that comes up, there's some very basic things that should be the focus of attention in protecting the patient population. And I'm talking about infection control in the workplace, proper personal protective equipment, training of staff, making sure we have adequate staffing so the staff can follow infection prevention and control mechanisms, adequate ventilation, adequate cleaning, making sure that our health workers are paid properly so they don't have to work in 2 or 3 different facilities, which poses a bigger risk, making sure they have enough sick time benefits so if they're sick, they could stay home, and making the vaccination program and the vaccines as easy to access as possible so that people can easily access, get their appointments, not lose time and money from work in doing so. So in essence, I believe that our first priority has got to focus on caring for our patients, doing no harm, and making sure that the environments that we're caring for people in are safe as possible from whatever variants or emerging diseases come up. Promote the vaccine with state-of-the-art, honest data as it changes, making immunization easy and convenient, and strengthening trust before we impose upon people. The basics of ethical arguments of requiring any medical intervention is that there be a benefit to the individual, benefit to society, and no good alternative. In terms of benefit to the individual, we know that the vaccines are good. They may not be 100%, and for 1 dose particularly, there's really some lacking, but even with 2 doses, they're far from 100%. We know there are side effects, but also there's a question of procedural fairness. If you're going to bring in a policy like this for new hires, but not existing workers, is that fair? Is it fair? What about visitors? Will you require vaccination mandatory for someone to visit the facilities? There's all kinds of those sort of issues. I'm not the lawyer in the group, so I'm not the expert in that regard. But think of a scenario. I mean, what if Pfizer and Moderna stop supplying Canada because needs are greater elsewhere? Maybe they get better dollar for their vaccines elsewhere. What if all we have is a vaccine that has higher rates of side effects? Would we still require it to be mandatory? So there's all sorts of scientific issues that are not well worked out at the moment. in terms of benefit to society, one thing for sure is that we do not know that people who are fully vaccinated are not able to transmit the disease to others. That's why even people fully vaccinated still have to wear masks, still have to physically distance from others. It's not a magic bullet. And there's a danger that if we treat it as such, we may drop our guard for more important things that we have to do. And then, so, the third piece of the triad of benefit to the individual, benefit to society, and alternatives is there are alternatives. The alternatives have been very effective, which is that proper infection control measures. I work at Vancouver Coastal, and we have really excellent data showing that we're protecting our workers very, very well in the workforce. So with the principles of respect, equity, transparency, and rationale, I think it's far too soon to be moving to considering whether vaccines should be mandatory for any group of workers. And as a final remark, I want to say that in the jurisdiction where I have access to data, our vaccine hesitancy rates are very low. Upwards of 80% of even long-term care workers in Vancouver Coastal have already been vaccinated. So let's not make a problem where a problem doesn't exist, and work on strengthening those things that we can strengthen. Thanks. Those are my opening remarks.
Thank you, Dr. Yassi. And now we'll go over to Barb MacLean. Barb. Barb, you're muted.
What an incredibly important topic. And in preparing for today, I really thought that it would be important to tell you that my lens is about bringing perspectives of family and family caregivers and how they may or may not be viewing the world of COVID. And we have an entire year to learn from. First, I'd like to share a little bit about Family Caregivers of British Columbia. And the fact that we've been focusing on the role of family caregivers for many, many years. And I think given what the pandemic has offered to us, it's an opportunity to learn and do things differently. So our society is about the quality of life for family and friend caregivers, and there are about 1.3 million today in BC that are caring. We offer caregiver support directly, and we have a BC caregiver support line. We provide education to both care professionals and caregivers. And then we do a lot of work around health system engagement and collaboration. And through our partnership with the Ministry of Health and patients as partners, for about the past 5 years, we've been looking at ways that the role of family and person and family-centered healthcare can be woven through all systems of care. And when we look at continuing care, the entire sector from long-term care, assisted living, and in-home support and in-home care, we see that there are examples of excellent inclusion of that voice and some examples of horribly not included and invisible. And so the message that we've been hearing from family caregivers through mainly research and our caregiver support line over the last year is we would like our voice to be at the table. We would like to be included in these decisions and these conversations, and vaccinations is a huge topic for them as well. We think about systemic response and not leaving it up to individual providers or operators. We have seen the incredible variation across the province that hasn't really been effective. We don't have a place to put the voices of family caregivers systemically, and we look at mechanisms like family councils to encourage and support their development so that that voice is there at every level. We have been really successful in seeing more and more families, family caregivers being at tables where decision making is occurring, but they haven't really been there throughout the pandemic at the provincial level, and we'd like to see that change. What we'd like to also encourage is the dialogue about the role of family and friend caregivers in our systems of care, and that they're not all visitors. So making the distinction, the very specific distinction between those essential partners in care and a visitor is really important. And I'll stop there, Terry.
Well, thank you, Barb. And we'll go to some questions that I have prepared. We hope that we will be able to save some time near the end to see if there are any questions from our audience, which is quite large today. So if you don't have your question answered, perhaps we can follow up with you afterwards. First of all, Dr. Yassi, you said that the vaccination uptake was quite high, and that is certainly true for Vancouver Coastal. But we do know that in other parts of the province, among long-term care staff, that it is not as high as perhaps it is in Vancouver Coastal. We heard at the Cottonwoods in Kelowna, for instance, where an outbreak occurred, only 65% of staff were vaccinated. Al has experience in some of his homes where staff vaccination uptake has not been as high as 80%. So let's talk about hesitancy. Maybe each of you can just give me your thoughts around hesitancy and why you think people may be questioning whether or not to get the vaccine when they work in such a vulnerable environment. I'll start with you, Al.
Vaccine, we have tried hard to encourage our staff. We do have in-services, and we have explained, what it is. But besides hesitancy, sometimes I think it is just simply access, where, some health authorities had insight vaccinations and the uptake was higher. In others, you have to book an appointment to go, online and go, and there, that's where perhaps the vaccination rates have been a bit lower. There's also, staff, the concerns about health, the concerns about the efficacy of a vaccine. Some people may be waiting for Pfizer to come along. So those are some of the reasons that that are given to us.
What do you see, Dr. Yassi, is driving hesitancy?
Yeah, well, I echo what was just said, is that I believe that a lot of what we're calling hesitancy is just the lack of convenience and access. The booking system is not easy for people to manipulate. You have to get online. Often you have to wait. Often it takes a while to find an open place to book an appointment. So I think the first thing that we need to do to boost the vaccine uptake is make the vaccine clinics really easy to access and book. And until we've done that, I don't know whether we can even really be talking about vaccine hesitancy. It might have just been vaccine inconvenience. So it's hard to say. Beyond that, I think that the AstraZeneca and Johnson & Johnson issue with clotting is a factor, and all the attention to it in the media has not help that matter necessarily, although I'm not for a moment suggesting that people should not be kept informed. I totally believe complete transparency in data, but it's a matter of what's emphasized. So I don't think we know the answer for why the rates are higher. Certainly the medical staff that I look after, we're up to about 96% vaccination of the medical staff in Vancouver Coastal Health. So there's zero hesitancy. The 4% that's not yet vaccinated, they have good reasons for it. It's I think that we don't yet know how much of this lack of vaccination could be attributed to lack of convenience, access, and those kind of things.
We did hear anecdotally that homes that had an outbreak, at the height of COVID, their staff were more likely to take the vaccine than those homes that did not experience an outbreak. So that may be a factor. Barb, what are families telling you in terms of whether or not people working in homes should be vaccinated?
Well, I can say that it is anecdotally, when we haven't surveyed this particular topic, although we do have a survey that was released in the field in December, and we look at the role of family, having learned a lot about that was one of the questions that in its entirety, every single response we've had so far, that if we grouped it together as a theme, there is no hesitancy. Hesitancy on the role of family, first of all, saying, if I'm an essential partner in care, include me as one of those people on the front lines. I want a vaccine. That message is incredibly loud, and they haven't been able, in order of priority. I think we need to separate the narrative from all citizens to those people working in our sector, and being very, very surgical about that. And we would consider that the role of essential care partners, those family caregivers, are not hesitant. They say, I would like it. the understanding that family are looking for a mandated response or a consistent blanket response. That doesn't mean that what they can receive in one community or one care center is different from the other. That has been a message as well, loud and clear. So if we are going to have a systemic response, that is a good thing. If we leave it up to separate operators to make those decisions, I think that that's where some hesitancy might come into play. Do I feel safe with the person I love in that facility versus that facility? So.
Very good comments. Al, you're the lawyer on the panel. And while, of course, anything you say can't be used against you later, just talk about the legal implications of a mandatory policy and maybe explain why Park Place decided on, a kind of a fit for work for new employees on vaccination.
Well, as I say, the pandemic has forced us to think more clearly about a lot of issues. And when you had the situation where care homes are facing class action lawsuits, concerns from families, staff as well too. It was difficult to get staff to come to work. Because they were concerned. So all of these, were pressing upon us. And then, we started looking at legislation. We canvassed very extensively. I'm on the board of BC Care Providers Association. I'm also on the board of the Alberta Continuing Care Association. And I did, canvass my colleagues in terms of what they are doing, at their homes, how they're facing issues, and how we can navigate it through. When we reviewed the legal situation, there are sufficient precedents in place. TB testing is mandatory, for example. Flu tests, influenza vaccines, are in place as well too. That we felt that we could navigate a way through all the layers of law while still being respective of the bona fide cases or situations of certain staff who may have a valid reason or good reason not to be vaccinated. So we try, at the same time, we have an obligation to keep all of our residents safe, all of our staff safe, make sure that we can continue to function actually in effect as long-term care operators because it has been very, very challenging for us.
Thanks, Al. We saw with the Quebec legislation that they had a provision in there that if you did not choose to take the vaccine, mandatory rapid testing 2 or 3 times a week would be another alternative. We had our lunch and learn recently on point of care rapid testing, very well attended, and I know many of our members will start rapid testing. So maybe starting with you, Dr. Yassi, do you think that that's an alternative that could be put in place for those who choose not to get vaccinated for whatever reason?
Well, the problem is that the accuracy of the test is not great. And so there's a danger that there'll be a false sense of security, that you take the test, it's negative, you can come to work. It's not, I don't think its accuracy is enough that it would give me any sense of comfort in its use. It also sucks up resources, and I'm really big on the issue of put the resources into infection control, into all these other things that we talked about that I mentioned earlier, whether, the adequacy of staffing, of pay, of sick time, rather than putting it into something that may be a false sense of security at best. We stopped doing things like taking people's temperature everywhere because it was so inaccurate. So the rapid tests may improve. We may get more data on their value, but at the moment, I don't think that's a great solution.
Well, it'll be interesting once we have more operators using them to get that data. As you say, it's really important to know. Barb, some of our operators are using rapid tests today, and in fact, using them for visitors as well. Have you encountered any feedback from people that you talk to about the use of rapid tests?
We don't have a lot of feedback about that. The sentiment would be, please make it available. I think what families are telling us at all costs, we'll do what we need to do because we need to go see, we need to get in. So if that's an option and that's a choice, please use it.
And the other sort of component of this is declaring whether or not someone is vaccinated. When I was Minister of Health and we had a lot of measles outbreaks, there was a huge call for mandatory vaccination for schools. And what we settled on was declaring the vaccination status of your child when registered. So, is that a tool that could be useful in terms of deploying people into different areas of the nursing home environment, knowing their vaccination status? And Dr. Yassi, let's start with you.
Yeah, I do think that confidential declaration is appropriate. Which means that people don't have to wear it on their lapel whether or not they've been vaccinated, but there should be an occupational health program within that services the institution, whether it's a part-time nurse or someone who is a health professional that knows the vaccine status of the staff that work there. So that if there is an outbreak or if whatever comes up, it's known who are the people who are more vulnerable that need to have special accommodation if necessary. So I think declaration, but in a confidential way, is appropriate. And I think it's also appropriate for records to be kept. I think it's irresponsible for employers not to know the status overall of the workforce that they're in charge of, but not necessarily individuals.
Right. Al, your thoughts?
Sure. I agree completely. I think that, we have to be respectful of privacy legislation as much as we can, but all employers have confidential information with regard to employees on file, and we keep it and maintain it very, very with appropriate protocols. And similarly, within these rules and this setup, we can take mandatory vaccination status of our staff and maintain it appropriate, within a confidential setting.
And Barb, what do you think are the rights of families to know what the vaccine uptake is by staff in any particular environment?
I think, well, being as an employer perspective, making sure that the confidentiality of employees is paramount, whereas the safety of the person is the main concern. To report on individuals, no. For reporting on a status of a care agency, to be able to be reporting on how are they following guidelines or protocols, yes. So having assurance is what families are talking about. We need to know how safe is the person I love. And so that's the interest, not the position. It's how safe is, so what reporting mechanism is going to fit systemically here, not just individuals. I don't think at any time, for me, I'm thinking, can you imagine being identified as an individual in your workplace for any kind of a confidential issue? So this should be applied evenly in my perspective.
And we hear a lot about educating, reassuring, and we know our partners at Safe Care BC have done a tremendous amount of this in terms of reassuring and reaching out to people working in our sector about the importance of getting vaccinated and answering any questions they may have. But could we do more? I haven't seen a lot of proactive outreach by the ministry, for example, or the public health office. Dr. Yassi, do you think we could be doing a better job of answering people's questions about the vaccine to reduce hesitancy?
Yes, before answering that, if you don't mind, I want to go back to the point of what the public should know about the safety of the environment that their loved ones are in. Is to drawing on my international experience in South Africa, they do these infection prevention and control scorecards, so that there are these workplace audits, so to speak, for the infection control measures to see what is actually being followed on the ground, and so that those are potentially available to people, so someone would know what's the infection control record of the facility, not just the staff. In other words, don't just blame the workers. Let's look at the responsibilities of the employer as well in maintaining a safe environment and following all the proper infection control procedures. In terms of could we be doing a better job in BC about information access? Yeah, we probably can. I think BCCDC has been doing a great job. The dashboards are available and all that. Could it be a bit more granular? Yeah, it probably could be. And I think as time has gone on, it has become more. At one point, we didn't know where there were exposures within schools. Now you could look up the schools to find out where exposures have been. So I think over time, more and more information is becoming available and made available at that level, and finding the right balance between avoiding stigmatization, but still allowing people to know what they need to know for safety.
And Al, your thoughts on education or maybe even incentives? We've heard that people are sort of giving incentives to get their staff vaccinated. Any comments on that?
Yeah, I'd say that there's a huge demand for information. Families want information. The family council meetings, virtual, that I have sat in on, families are asking questions and they want that information. So, while there's a large, province-wide information, high-level information that is coming out, there's a different set of information that families want in terms of how it affects their loved ones. What some family members are now asking, for example, is that, do they have the right to insist that a care staff who's not vaccinated not care for them? For my mom, I only want my mom to be cared for by vaccinated staff. So these are types of issues that are coming forward, and they want answers to these questions, and we are placed in difficulty here. I mean, for Park Place, having gone through that case situation, our answer was one of reasonable accommodation. We will try reasonably, but if there are no no vaccinated staff to be found, then we will be unable to meet that requirement. So we have to be, we have to try and meet the rights and expectations of families, but also we have to acknowledge that there are limitations in terms of resources that we have.
And Barb, what do you think we can do to help families around information around the vaccine?
Well, this theme is something that we've heard so strongly. It is the number one thing emerging out of the pandemic is please communicate with us regularly, openly. And I do believe, much like Annalee was talking about, trust as an important issue, regardless of what the answer is, to Al's point about accommodation, whatever, they're going to do their best, but they would like to know what is going on. So there's doing to versus doing with, but there's also just two-way communication about please tell us what is going on. So that has been probably one of the biggest failures early on in the pandemic. Humongous, I don't know, the most anger that I've ever seen around issues concerning families, around not knowing what's going on. There's got to be a better way. And some providers have done an excellent job. And we say, well, why is that? How were they able to do such a great job? And the second aspect about communication is it's okay for a period of time to be one way, but at some point, where's the reciprocity to hear those voices and be included in the conversation, in the topic, and not necessarily just saying this is the way it's going to be, but to invite the role of families to be at the table when these discussions and ultimately decisions are being made.
Just thinking about the quality of life, and this question wasn't part of our prepared package, but it seems to me that vaccinations, though not perfect, do provide a level of protection that is pretty high. We've gone through 14 months of our seniors being isolated, deprived from seeing their families. They've had to take personal items out of their rooms, very much an acute medicalized kind of response. Vaccines have made a huge difference. And then in the future, of course, when we think about all the other viruses that will come along, can each of you speak to quality of life in long-term care and how vaccines can add to quality of life and maybe sort of declinicalize the environment, which is, of course, people's homes? Start with you, Al.
So vaccination has brought huge relief, right, to long-term care. It was just, we were just so much on edge, and it has relieved the pressure, and so that has allowed us to focus on some of the, the residential care, the small touches that matter, with our residents, allowing them to go back to communal dining, for example, where residents were locked up in the rooms for so long. And before we, to try and encourage a bit of communal, we'd get overbed tables, we would set them up at doorways of the room so that at least they could have some eye contact or some visual contact with the outside world, and that was their window on the world. So just the small changes has been huge. So yes, vaccination has improved the quality of life.
Dr. Yassi?
No question that vaccination has improved the quality of life. No one is arguing against vaccination. What I'm bringing up is whether it's wise to make this mandatory, and the distrust that might create, the undermining of the paying attention to the nuances of the information that has to be presented, and the distraction from the bigger picture of the whole package of the non-pharmaceutical interventions as well as vaccination. So of course, vaccination is a good thing. And, as I started off my discussion, we've promoted it very actively. I have, my family has, but also in Vancouver Coastal where I work. So the issue isn't whether vaccine's a good thing or a bad thing. The issue is what's the impact of making it mandatory as opposed to using other methods to try to boost up that vaccine rate.
And Barb, can you comment on what families are telling you about life post-vaccination for their loved ones?
Huge relief, and absolute. You can feel it, you can touch it, you can just imagine it. It is one of the most joyful things that have been happening, and I mean, of course, when we look at it, it's not 100%. Nothing's 100%, and we need those layers of protection. We need more than just a vaccine to hang our hats on. But even when we think about if you're a person who stands between making sure that your mom's medication and assisted living is topped up to someone living in long-term care who already has somebody looking after that, the fear remains the same, that if you're the person entering and you carry the virus and you infect somebody, the horrific consequences, that living in fear part has been the relief from that has been a beautiful thing for so many people. So you'd say for families, for people working in the care sector, and it presents the opportunity to explore how to systematize learning from the past as we move forward in the future, because quality of life is really what we're talking about.
Dr. Yassi, go ahead.
Yeah, I just want to jump in that workers in long-term care, I'm sure, would endorse everything that Barb just said. They too want the residents they take care of, the patients they take care of, to be happy and healthy. That people care about doing a good job. Nobody wants to bring infection into a workplace, and so giving people the dignity of choice may end up having even a better impact than making it mandatory, as if they are not going to choose the right thing for themselves and for their patients and for their families.
I want to make sure we have some time to go to questions from our audience. But Al, I want to go back to something you said, and that is the issue of potential legal action against an operator. We know that health authority owned and operated care homes, are self-insured by government, but we know too that lately the insurance industry has refused to cover infectious diseases. We are currently covered by an immunity through the public health order, but that's going to end soon. Is there a risk to operators that don't have a mandatory vaccination policy in place to lawsuits should a COVID outbreak occur?
So operators are having huge issues getting insurance, and in fact, I know of some operators, and it's a non-profit home, for example, that is only getting insurance every 2 weeks. And every 2 weeks they then have to sort of give an update on the status of the outbreak before it gets renewed. So that places huge constraints on us. When you go to renewal now, insurance companies are now providing us with a huge checklist of items. We have to provide our plans as to how we're dealing with COVID, what we have in place and they then sort of review the adequacy of those plans before they decide to insure. So yes, in that sense, mandatory vaccination, we do have a policy. It provides greater stability to operations in the sense that at least we can get insured. We don't have to worry about an insurer pulling out, and also insurers are not taking on any new clients. So when an insurer declines you as a client, you will not have anywhere else to go to. So for stability of operations, yes, mandatory vaccination helps us. It helps us provide that assurance that insurers need.
I see a few questions coming in from the audience. One from Cindy, who says, we've put a lot of pressure on staff to be vaccinated. Now that long-term care homes have opened doors to visitors, how do we protect our residents and our homes from visitors who may or may not be vaccinated? So Barb, let's put that one to you first of all.
Well, I would say the response from families, as far as we know, is just utter, bring it on, give me the vaccine, I'll go there, and don't make me wait. So we need a mechanism systemically to identify that caregiver so that they can get in line and be considered as someone on the front lines or close to it. And so that hasn't happened universally in BC. And the other thought about is we've already seen some examples of, imagine if you can't be vaccinated. Well, there's alternatives. There's the rapid testing, the use of PPEs, and the ability to still be connected. So you eliminate the bulk of the fear of bringing in the virus. But you're just seeing tremendous, tremendous support from families to get that vaccination.
And Annalee, any comments in terms of visitors and how we can protect residents from potentially unvaccinated visitors?
Well, I think whatever policy that one has within the facility should have to apply to others who come in. So if there's, if vaccination is strongly encouraged and has to be declared, then that could apply to visitors as well. Because I'm not in favor of mandatory vaccination, I'm not going to say visitors should be, but I'm with Barb. I would think that the vast, vast, vast majority of families will want to be vaccinated. So I think it's unlikely that there'd be a huge proportion of people who refuse to be vaccinated but want to be able to visit someone in a long-term care.
And another question is around, is there data to suggest the uptake between nonprofit and for-profit residents is any different? Now, Al, I don't know if you can speak to that. I'm not aware of that data because, quite frankly, we don't have access to that data, which has been one of the issues that I think operators are dealing with. But Al, any comments on any potential differences in vaccination uptake, one home versus another?
Yeah, so at the board of BC Care Providers and the Alberta Continuing Care Association, which has both non-profit and for-profit members, we do compare our checklists, and we do a raw tally of our percentage rates, and from what we can tell, there is no difference. I think if there is a difference, it is more between urban and rural areas. We're seeing a bit of a lower uptake in more rural areas. But that may have to do with access as opposed to anything else. So.
And do you think, anecdotally, I mentioned that homes that have had an outbreak are more likely. Do you think that the threat of COVID is different for homes that underwent an outbreak? You have a home in Kelowna that's currently under outbreak. Can you comment on that?
Yes, most definitely. But when you do have an outbreak, the health authority will immediately prioritize your site for vaccinations, right? And they will bring a team out to get everybody vaccinated. So that helps, everybody get vaccinated, and its access as well too is significantly increased at the time.
And while I've got you on the hot seat, Al, another question from our audience. If you put a mandatory vaccination policy in place and someone has an adverse reaction, are you as an employer going to be held liable for that adverse reaction?
We do have, I'm going back to my earlier answer. Fortunately, we do have insurance, as an employer. And, if it's a direct result of our policy, I'm assuming that the administrator of that vaccine, the employer, the insurance companies can fight it out, right? And decide who gets to cover this liability.
It may be
Annalee.
it may be workers' compensation
Yes.
because side effects from vaccinations for flu, for example, have been compensated by workers' compensation. I know in the past. I should note with respect to your earlier question about the differences in rates, I don't know the answer, but I want to mention that we do have a project about to start, a collaborative research project with Interior Health to start looking at some of these issues. It's just going through the ethics approval stage right now.
Excellent. Excellent. Well, listen, I would like to give each of you an opportunity just to have some short closing remarks, but I want to thank you for your participation and your very thoughtful comments. Barb, let's start with you.
I'm looking at a question in the question box, and the question is, can we get to a place where families considered essential so they can enter long-term care just as staff, and companies who outsource food and services to people and doing hair, very, very strongly, if we really take a new lens where we identify those essential partners in care, and then realistically, they're not the same group of people that might have a cup of tea once every couple of months as visitors. That essential partners in care, if I were to close with one very specific change, it would be that we have a mechanism to identify those essential partners in care, and that they are included, just as Annalee said, just as anybody has access within that facility, so do they. They are counted, they are considered, and they are included.
Al, over to you.
I just want to thank my co-panelists today for all their contributions and comments. They've brought valuable insights for those of us in care homes and operating, on the hot seat. We appreciate that. I appreciate the questions from our audience today, as well as from you. It has just brought dialogue and discussion is important. It brings a lot of clarity to the situation. We have taken a certain stance, but as I said, it is evolving. We will be evaluating it, our position, as we move forward. And hopefully, through this, we will end up in a better place.
And Dr. Yassi, the last word to you.
Oh, thank you for that. Let me start by saying that a very good friend of mine's an ethicist, and on almost every issue, we're like-minded. But we aren't like-minded on this one, which just shows me that it's not an easy issue, that people come from different perspectives based on their experience and their history, and there's no real clear right answer. But let's make COVID-19 a wake-up call to see what more can we do to make our long-term care workers feel safe and feel valued. And I think if we look at this issue from that perspective, I think we'll have a legacy that will benefit us for a long time to come. So thank you, everyone, for allowing me to participate in this discussion as well.
Well, thank you to each and every one of our panelists, Barb, Al, and Dr. Yassi. I really do appreciate your insights today. And, this is, we've done a lot of lunch and learns and care to chats. It's just an amazing opportunity to provide information. And so many people are interested in seniors care and the crisis that has been brought about by COVID-19. As you said, Dr. Yassi, this is an opportunity to improve the system, to reduce ageism and stigma in seniors care, to make it an attractive profession for people. So this discussion today is all part of that. So thank you, each and every one of you. I want to say a big thank you to our BC Care Providers staff, Kathy Smoz, and her team, as always, have done a tremendous job. And she would not forgive me if I didn't remind you about our virtual conference coming at the end of the month, the 3 R's: reflection, resilience, and reinvention. It's going to be a great opportunity to take a look back and then to take a look about how we can go forward and improve the seniors care sector. As part of that, Andre Picard, the renowned Globe and Mail columnist and author, I'll be having the opportunity to have a chat with Andre about his new book, Neglected No More, about the future of seniors care in Canada. We know many of you will be interested in that. So thanks to everyone. Enjoy the rest of the week, and we'll see you at our virtual conference at the end of the month. Thank you.
Thank you.